2021. And vaccination rates for students in Florida have dropped to a 10-year low.
ABC Action News reporter Rebecca Petit takes a deeper look at the number and why experts are calling them concerning.
As a social worker for the child welfare system and mother of 3 young girls, Kimberly Lasher believes keeping her children up to date on vaccines is a smart thing to do for her family.
To keep them healthy, to keep others healthy, to make sure that, we're not contributing to the spread of any diseases that have, pretty much been eradicated.
During the pandemic, she was concerned her children would not be able to get their scheduled immunizations.
Back in 2020, when we were all shut down due to COVID, it was difficult to get the kids in for their, yearly well checks so that we could be up to date on, their vaccine schedule. However, we have been able to catch up on those vaccines.
Last school year marked a more than 10-year low for Florida's kindergarten and 7th grade students completing all doses of required immunizations, according to a new report from the State Department of Health.
It sounds very alarming, why aren't people, keeping up with their routine vaccinations for their children?
The report showed about 91.7% of kindergarten students statewide completed the required vaccines during the 2021-22 school year, and 94.3% of 7th grade students completed their shots for the last school year. The state goal for students to have received all doses of required vaccines is 95%. The required immunizations, which do not include COVID-19 vaccines, protect against diseases including tetanus, diphtheria, measles, mumps, rubella, hepatitis B, and polio.
We just don't see them very often, so parents sometimes don't feel like there's a risk in getting the disease, but it's because we've been so vigilant about giving vaccines.
Dr. Lara Kavanaugh tells me the pandemic is partly to blame for the drop in vaccination rates when kids did not come in for their well visits. She also attributes this decline to vaccine fatigue and misinformation.
There is probably some misinformation out there as well. But I think there's just a lot of information, period. It gets very complex trying to sort out what's right for your children.
Pediatricians tell me as rates fall, we will start to see breakthrough cases, leaving unvaccinated people unprotected.
There's kind of this misconception that, we don't have these diseases here in the United States. It's not that big of a deal if I don't get my vaccine against them. But it will become a big deal. And as these rates drop lower and lower, it's very concerning because we're leaving pockets of vulnerable people.
Dr. Lisa Cronin tells me it's important for parents to have a pediatrician that you trust to discuss what's best for your child.
Maybe they heard something or they're wondering something or they're not as in-depth familiar with the science behind something, and we can help explain and clarify.
Rebecca Petit, ABC Action News.
So we do want to take a closer look at vaccination rates here in the Bay Area. The state's health department website breaks down the vaccine rate by county, so we put it in this chart for you. This data covers full vaccinations, meaning students have received all of their shots and doses. You can see right here, Hardy County actually saw the highest at 98%. Polk County saw the second highest at 96%. Hillsborough and Pasco sitting at 94%. Pinellas is at 90%, and Sarasota County schools had the lowest vaccination rate sitting at 87%. So you may be sitting there thinking, what shots are required? The CDC has a schedule of vaccines for kids, and it's right here. It's a little bit confusing, but they include hepatitis B, rotavirus, DTaP, pneumococcal, polio, measles, mumps, the flu, chickenpox, and hepatitis A, and also at this point recommends getting the COVID-19 vaccine.